So I am board certified in internal medicine and spent a majority of my career in actually hospital medicine, which is the care of hospitalized patients. And over the many years that I was doing that, I realized that I was taking care of patients with progressive chronic disease. And when I would see them in the hospital, it would be, in snippets of time where I was just kind of putting a band-aid on their acute exacerbation of a chronic condition. And, I kind of think of it, and a good analogy would be, it was like there was this, running faucet and I was just trying to mop up that water on the floor instead of, turning the faucet off. I said, I want to see patients from the beginning where we could talk about preventive measures. Yeah, everybody's process is different. But it is interesting because there's now studies that are showing that women can start experiencing symptoms like even 7 to 10 years before they actually go through menopause. Some of the more sort of, well-known symptoms of menopause are, that the hot flashes, the night sweats. Um, People will also often talk about low libido. That comes up quite a bit. They might have, changes in their periods, and that is usually the first sign that comes up. This is the perfect pictorial representation of what's going on. So premenopause, so this is before you go through any sort of changes. This is the prime of your reproductive years. You can see how your hormones are very regular, right? Very predictable. And so even when, some of you may experience maybe some premenstrual symptoms, but when they're coming, right? Because your periods are very regular. However, when you're going through the perimenopausal period, your hormones are all over the place. And this is so I just love this graph because everybody's chaos of perimenopause is different, but it's exactly that. It's chaos, right? And you don't know where you are. So when you are going through that transition, your hormones are fluctuating in an erratic way. There's no rhyme or reason. It's not like that, EKG line that's very regular and very rhythmic. It's all over the place. When you're having brain fog in particular, many times it's just about understanding that this is a symptom that generally is limited in duration, right? So women who are going through the transition should understand, okay, this is really is something I'm not going to experience this forever, right? I'm going to come out of this time and that brain fog and that memory loss is going to improve. People ask like, should I take supplements? Should I, will hormone therapy help? I don't recommend anything specifically. You can talk about if you have the risk, if you have risk factors, if you have for hormone therapy, or if you would be a good candidate. But generally speaking, if you're otherwise feeling well and you don't necessarily want to go on hormone therapy, you should just understand that optimize your lifestyle factors to the best that you can, and then know that this period of symptoms and this transition won't be forever, and that you will improve, and that memory loss and brain fog will lift. Because of that lack of estrogen, you are now at a higher risk of depositing weight, especially in your abdominal area. And that type of weight can be dangerous because you're getting deposition of fat around your liver. It's like visceral fat. You've got subcutaneous fat. That's the fat like on the outside, right? Like if you could pinch it. And I know people don't like it, but that's more aesthetic. It's not really causing a lot of inflammation. But the ones that get on your belly, that's when you start developing medical issues, metabolic concerns. So if you find that through that menopausal transition, you really are just gaining weight, right, that you are unable to manage despite nutritional changes, despite exercise changes, GLP-1 support could be reasonable for you. Okay. But as with any medication, I tell people this: all medications have side effects. But I don't necessarily advocate a GLP-1 for patients who maybe gain 5 or 10 pounds and right for aesthetic purposes. Protein is super important during this transition because as you're going through the menopausal transition, you're also aging, and that aging process ultimately leads to a decline in muscle mass. Right? And so starting at actually age 30, you lose 8% of your muscle mass per decade. Okay. So In order to offset that loss, you need to supply your body with amino acids, which are the building blocks to, build and maintain and repair muscle. So I always recommend, again, like the standard, breakfast foods, including cereals and croissants and all that. None of that has the protein that we need. So I always say in my plate, if I'm prioritizing a plate, I always make sure we have plants and protein, some sort of plant and some sort of lean protein. And that, to people, that it simplifies it. And if you start your day with that plants and protein, what I'm finding for people is that they get less hungry, right? So the people who tend to eat those like refined carbohydrates to start their day, they end up having a spike in their blood sugar that then, like a couple hours later, mid-morning, they have a crash and they feel irritable or cranky and they grab another coffee, or they're like, I need something. The people who eat that big breakfast that I mentioned, they really feel like they feel sated and they're able to get through lunch and feel energetic without those swings in their blood sugar. Yeah, this is a big one. I think forever, and I think for most of our adult lives, we've been told alcohol in moderation. And more and more studies are coming out to show that actually no alcohol is good for you. And it's definitely a factor in many different types of cancers. I say this, I also know that alcohol, like, and I mentioned this before, in menopausal women, you're metabolizing alcohol differently and not as well. You're not tolerating as well. And so, it is a time to reflect and say, how much am I drinking? How is it affecting me? Am I having trouble sleeping? Do I feel tired? Am I having brain fog? You have to really sort of step back and say, am I really able to tolerate this right now? In terms of your health, I, would recommend you drink as less as possible. I don't advocate for a drink every day. With that said, if you're out dinner on a Friday night, can I tell you that having a drink, when you go out once a week is going to cause harm? I will say though, I know for a lot of women, they can't sleep. And so if you have that drink, you have to consciously say, I'm going to have this drink, I'm going to enjoy it, but I know it might affect my sleep tonight.